Blue Cross Ambulance.
Across the capital, one of the UK's only animal ambulances is picking up sick pets for urgent treatment.
Come on in.
Ready to receive them are two of the country's busiest animal A&E departments, where Blue Cross staff and volunteers
Sorry, I'm holding a puppy. I can't do anything.
Stop it.
work 24/7 to get more than 19,000 animals a year back on their paws,
Can you go to an emergency, Southwest 11?
treating everything from cuts and bruises to critical injuries.
We've done some serious damage.
Not forgetting life's more embarrassing little problems.
It's the anal gland smell.
We have weed. Hooray!
And no 2 days are ever the same.
A nurse to triage a seagull, please.
It's just the worst job ever.
At least I've not got pinned on just yet.
Blue Cross ambulance driver Lee is heading across London on his first pickup of the day.
Today we're picking up Bob the cat. Bob's got some skin issues, just where he's being really itchy.
Bob's been on steroids to treat his skin condition and is due a checkup. But Bob is something of a tubby-tabby, so owner Sandra's called on the ambulance to transport him back to hospital.
When I picked him up last, he was 10.95 kilos. I believe he gets a few treats. I think the owner says he doesn't, but the scales tell another story.
As with overweight people, Bob's extra pounds could be causing dozens of health issues, including making him unable to groom.
He's quite a large cat, so I'd imagine being itchy as well isn't great because he can't reach some of his itchy areas, bless him. Blue Cross. How are you? How's Bob? Let's see. Come on, Bob. Well, at least I think I'll be able to catch ya. Come on, Bob.
No one intends to harm their pets. They do it because they love them. But I think a lot of people don't realise the impact that obesity can have on cats and dogs.
And with his heavy load, Lee heads off to the hospital. And back at Victoria,
Come on, little boy. Come on.
Nurse Hannah and Chief Vet Mark are treating a dog with the opposite problem to Bob the cat.
Oh, nice waggy tail. Is that a nervous tail? Good boy.
I love being on the shop floor. It's nice to have a joke with the team as well. It's normally at my expense though, that's the only problem.
I'm always picking on Mark. Sit down, Angus. That's a good boy. That's a good boy.
Angus has been struggling to eat anything because of severe gum inflammation.
This dog has really bad gum disease, stomatitis. It's the same as people, you know, it's the build-up of tartar and bacteria in the mouth. It's the bit that joins the tooth to the socket, the periodontal ligament, that becomes inflamed, and then the gums then become inflamed as a result. It can be very painful.
Want to put an IV in?
Yeah, we can do, yeah. Right, now we can start.
Mark needs to get to the root cause of the gum disease so Angus can eat again. Dogs have to be anaesthetised for dental procedures, so Mark will have just an hour's window to get the work done.
I just had a feeling it can be a bit nippy.
Okay.
Still quite weak.
I think it's a bit wet. I'm not giving him a lot, so give him a little bit more. I give him too much. Yeah, I don't want to keep him under too long.
Good boy, Angus. Should we 5 mil per kilo? 3 mil per kilo?
5 mil, yeah. We try and keep them to just around about an hour. Any longer than that, then we start to think about maybe doing one part of the mouth and then coming back at another time to do the rest of it.
With Mark waiting for the anaesthetic to take effect,
You've been stealing my business.
I have.
Across London, vet Charlotte and driver Jamie are waiting for their first patient of the day at the Blue Cross Mobile Clinic.
Hello, fluffy one.
Sally has brought her husky Che to see the vet.
I took him to the Harmsworth about 5 weeks ago.
Okay.
He kept continually licking his back paw and chewing on it, and it was swollen.
That left one.
Yeah.
Yeah.
Oh my God, she gave me antibiotics. Sit down, sweetheart. It's can I s- you can, no.
Yeah, you can
Okay,
sit there, that's
it's,
fine.
It's this one.
Yeah,
It's ever so odd. He's gonna start trying to lick it now.
that's fine. I'll muzzle him to have a
Yeah,
look
sure,
at the
of
foot, just because
course.
it's quite sore and it might upset him. I can see he's having had a good old lick at that
Yeah,
foot.
and it's turned pink.
Yeah, that's usually the colour they turn from saliva.
It's just really odd.
Let's see,
You
let's-
hate this, don't you?
A nail bed infection may sound minor, but if left untreated, they can spread to the bone and cause permanent damage.
His general health is good as it.
Fantastic.
We're just going to start by having a quick check of his heart.
Yeah.
Healthy heart. So there has been some improvement
Oh,
then.
the swelling went down, and then you could actually see what the real problem is. That
Okay.
one, I can see.
So
I've got
hold
him.
on, nice and
Yeah,
tight
I've got
there.
him.
All right, my friend.
Yeah.
I know.
It's all
right.
right. It's okay.
I know,
It's
sweetheart.
the nail, isn't
Yeah, I
it?
can see that he's got some trauma to the bed of the nail right at the
Right
base.
at the base where it goes into the paw.
Yeah, exactly. So that could well have been quite infected before if it was very swollen. What I would suggest actually is that we restart another course of antibiotics.
Okay.
Perhaps the course that we gave before wasn't long enough.
Yeah, she gave 5 days.
Yeah, so I think it still, to me,
So it's
looks
an
infected
infection.
in the
Right.
base of that nail. If after another week we're not getting anywhere, then I think we sedate him so
Come
we
here.
can have a better look.
Come on, I'll take it off. Good boy.
He's been very well behaved, actually.
He's not too bad.
All right.
Thank you.
No worries at all.
And it wasn't long before Che's poorly paw healed up after the second course of antibiotics. "150 miles up the A1 in Grimsby, Nurse Natalie's checking in 8-year-old Bandit.
When was the last time you had the antibiotic?
Yesterday
Yesterday evening?
morning.
Oh, morning.
Yeah, because
okay.
he used to have pate to get it down.
Right, so we didn't have one last night.
No, we didn't.
Okay.
Julie has found blood in Bandit's wee.
The reason for his blood is bad.
It's one of those things that until we know what we're dealing with, we can't really say. It might be that it's nothing to worry about at all, but obviously we can't say that for definite at the moment. Take it back to Mum. Oh, bless him. I'm sure he will be. You're a very good boy, don't you, Bandit?
I'm gonna go and have some breakfast because I didn't have any because I felt guilty eating in front of him. And because he couldn't have anything to eat, so. And yeah, just sit and wait for the phone to ring. I mean, I live on my own, so yeah, I can't wait for him to come back. I'm very glad.
When your pet patient can't communicate how they're feeling, diagnosing the cause of any symptoms can often be the toughest job for vets.
Anytime we're under anaesthetic, there is that risk, so we watch them this carefully from the minute we induce the anaesthetic until they're up and about and on their feet. The one thing I'd be worried about potentially would be a tumour somewhere. Hopefully it's more sort of a nasty urine infection, as maybe spread to his prostate, something like that, so fingers crossed for him. I just want him to be okay, because I love him. Yeah, that's perfect, thank you. Yes please. Thank you.
Bev's first port of call to identify the cause is an ultrasound.
This is the bladder here, so the darker structure is the urine in there, but then we've obviously got this whiter area in the centre. Can be a few things that can be, but the thing I'd be mainly worried about would be a bladder stone. Sometimes if you can get sort of little tumours that mimic them.
It's difficult to predict what a lump is just from looking at it. You know, you can have a suspicion, but really it needs to be tested to know for sure. There's always a worry that it could be cancer.
Obviously the big C word is a big stress and worry for people. Because if they are cancerous, something needs to be done about that sooner rather than later, before they grow too big and are more difficult to remove, or if they've spread anywhere else.
Cross Hospital in Grimsby, Vet Bev is trying to get to the bottom of the mystery lump in dog Bandit's bladder.
Looking at the minute like he's got a stone within his bladder, and it just aggravates the bladder lining. That will be responsible for the blood that we're seeing. So considering we're thinking that he may have had a tumour, if it is a stone, it's quite a good outcome for him. Right, okay, perfect.
Whatever the lump is, Bev thinks it's best to get it out of Bandit, which means surgery.
It's been a little while since I've done one of these. I suppose I'd say maybe a couple of years since I've had one. This is the bladder that we're just sort of trying to exteriorise. You can kind of just see on the top there's a little bubble, and it feels like we've got probably like a disc sort of shaped stone of some form that's in there. So we're going to try, and we'll make a little incision in and pop the stone out. It looks to be, at the minute, like a bit of a polyp or a lump of some form that's within the bladder. So we'll take this out and send it off to the lab and see what they've got to say about it. Sometimes it can just be a blood clot, other times it can be, unfortunately, a tumour. The important thing is we've done everything that we can do at this sort of stage, so we'll just be waiting and see, bless him. Poor little mite.
Back in clinic at the Victoria Hospital.
Morning.
Hello, how are you?
Not too bad.
Right, we are. I am getting Bob's notes up. Bob Brown.
Plus-sized ambulance admission Bob has been carefully delivered to Vet Jax for assessment.
Have you lifted that cat box with health and safety regulations?
Yeah, I bent at the knees, straight back.
He's been taking steroids for a skin complaint, and it's straight onto the scales for the dreaded weigh-in.
So he's been up as high as 11 kilos in 2016.
He is now 10.3.
10.3. This is the most dramatic change, because at one point he was a normal cat's weight. In 2009 he was 5.4 kilos.
A cat is considered obese when 20% above their optimum weight. So at nearly 100% over, Bob is way beyond a healthy size.
He now weighs twice as much as he used to, so he's two cats in one, isn't he?
Small dog.
So it could be that we've got to worry a little bit more for you, darling.
Part of Bob's recent weight gain may be because of the steroids.
Be strong, hold your breath. Thank you. Oh my heavens, that's embarrassing. Oh,
Got moves.
sweetheart, he definitely does. He's more of a bobette. Thank you, lovely.
Jax is keen to get Bob off the steroids in case they increase his appetite further.
Steroids are going to make him want to keep that weight on rather than lessen it. So the last steroid is today.
Yeah.
Okay, so what I actually have to do is then just wean him down over the next week. His skin now looks completely under control, but your weight is completely out of control. For him to be double a normal cat size is obviously detrimental both for his chest and his joints, and in cats we're very likely to end up with him being diabetic if we're not careful. Have we spoken to the owner about the elephant in the room, shall we say?
Numerous times.
Right. So I need to speak to her.
Thank you very much.
Upstairs in theatre, Mark's working against the clock. He spotted a major problem in dental patient Angus's mouth.
Quite a big pocket there, and the gum's a bit overgrown and it's bleeding the gum.
Cover your eyes and ears if you're not a fan of the dentist.
Yeah, these are really inflamed around these ones.
The bacteria in Angus's gums that's causing the inflammation could travel in his bloodstream to infect his heart or liver, so it's vital the problem is fixed.
And it does carry a lot of bacteria. That's why we're wearing PPE.
I think this is quite complicated because of all the problems with the stomatitis. I wouldn't say this is a straightforward one, actually.
And to make matters worse, 14-year-old Angus is starting to react to the pain of the surgery.
Might be feeling it. He's reacting a little bit. I think he's just sensitive. Everything alright?
Yeah, everything's good. He's settling down. Turned him up a bit. Did a bigger breaths for him.
I enjoy surgery. There is always pressure. People often describe it like flying a plane. You know, everything's going fine until suddenly something goes wrong. The worst thing you can do is panic. It's important that you've got a plan B. Maybe 2 on this side, but they're big cheek teeth. There's our first root. They can be quite long and a bit curly. At the ends, quite fragile. That's why you have to take them out and root separately.
It's a delicate business. If Mark snaps the tooth, the remaining root could be hard to remove.
Second root. This is another really big tooth with 3 roots. This one's solid. We try and loosen it up. It wants to come out. Sometimes get the root that breaks, but don't panic. There we go. Right, all done.
Yeah, he doesn't look like he's had a reaction.
And that will make him feel a lot better now. Right, okay.
Good boy.
Oh.
Angel.
The super vet was telling a story on GMB this morning saying that his dog got rushed in, saying he'd eaten something. When they opened him up, he'd eaten a red suspender belt, and the wife said, "That is not mine." How'd you get out of that one?
In Grimsby, Bandit's lump has been sent to the lab for testing, and Bev needs to make a call to his worried owner, Julie.
No worries. It is really, really difficult because at first all you can do is imagine it's your own pet in that sort of situation, and it's horrible for anyone when the pet has to be away. Hello, it's just that, you know, Bandit's in recovery now. We're doing really nicely. And what we found is that when we opened the bladder, it wasn't a stone as we were expecting. Instead, it looks like a little growth of some form. Unfortunately, we can't tell you a huge amount more as to what the growth is. We send it off to the specialist lab and get them to have a little look at it.
It's not the news Julie wanted to hear.
She's really concerned. She wants us to give him a big hug and make sure he's comfortable.
Julie heads straight back to the hospital to take her precious pup home while they wait to find out if the lump is anything to worry about.
And the phoned me and said it wasn't a stone, it was a lump, and I was like floored. I had no questions because I wasn't prepared for it. So, fingers crossed, get it sent off and make sure everything's okay.
Cats. Hi, baby. Hey, back. Oh, sausage. Hey, you've been a good boy. I just love him. And I don't want to cry. Stop looking at me properly, like it's my fault. See you later. Come on, Mum. She's my sweetheart. Thank you very much.
Bev will get the results of the lump biopsy in the next few days. And in London too, Vet Jax has a tricky call to make.
Oh, hello. It's Jack speaking from the Blue Cross. Is that you, Sandra? Oh, hello. No, I've just seen your lovely Bob. What I see is Bob's major problem is now his weight.
They'll suffer from bone problems such as osteoarthritis. Their mobility as they get in older age will be really hindered, and they'll be struggling along, and often the owner won't realise that they're struggling and they're in pain.
He's 10, potentially. If we get his weight down, he can live a full and normal life, and cats can get up to 17 or 18.
My last cat was 21.
I bet he wasn't 10 kilos though, was he, Sandra? Do you have food down for him to graze at whenever he likes?
Yes, I do.
Okay, maybe it's too easy for him. Some of the vets and the pet shops will have toys that make it harder for cats to eat. They have to pour the food out, they have to chase it up and down a tube. We want him to act a bit more like a hunting cat.
Yeah.
Excellent. Is that all right with you?
Yeah, that would be good.
Oh, thank you so much then.
Okay, bye-bye.
Thank you. Thank you, Sandra. So we might get started on some weight control if we're lucky and give Bob a longer and happier life.
Wait. Go hide quick.
come out this way now. He does need to lose weight. He's a good 3 kilos overweight.
Oh dear.
Which is quite a lot.
As Lee leaves,
You take care, and we'll see you in a month.
he gets a candid admission that might just explain Bob's size.
Don't give him chocolate. Chocolate is not good for him. Take care. When you ask, do you give any treats or human food? It started off with a no, then it went on to a little bit of boiled fish, and then she said he does love cheese and he really likes chocolate cake. So yeah, oh, and he also gets 3 meals a day. Because he's a growing man.
I think feeding human foods and treats is one of the biggest culprits for pet obesity. You get a lot of secret feeders.
We get a lot of dogs that are given a full sort of Sunday roast.
Chocolate, pizza, chips, all the kind of things that we really, really don't want them to have. Sausages, cheese.
They feed them cups of tea in the morning.
KFC sometimes. You think, no.
With Bob hopefully on the road to fewer snacks, up in Grimsby, Vet Bev has news.
Bandit's doing really, really well now. So we got the 4 lab reports back in the end. The lump that we found is just a polyp, so hopefully nothing at all to worry about, but it does have the potential that if we don't deal with the bladder issues and the underlying causes, that could become cancerous with time. Really, really nice sort of ending for him, because hopefully it shouldn't cause him a trouble again throughout his life. Clinically, you wouldn't know anything's happened to him now. He's really, really bright.
Next time,
It's going everywhere.
the team face a difficult decision when they're reunited with an old friend.
Boy.
And they get to make some gorgeous new ones.
Cute. Yeah, you're not having it back.